How will you care for your child once you leave the hospital? What will you need for his day-to-day care? Will the same type of equipment used in the hospital be available for use at home? These are some of the questions that may be going through your mind because you have a child who is medically complex or has a medical condition that makes him dependent on technology for his care. For all these reasons, Ann and Robert H. Lurie Children's Hospital of Chicago has a partnership with Almost Home Kids to provide a transitional care program that allows for nursing care around the clock.
Catrice came to the hospital the day after she was born. The problem she had a hard time breathing. And they had to put a breathing tube down her throat. But eventually she got the trach. After she got the trach, she got the NG, that didn't work. She got the G tube. And that's when after she got the trach, that's when they took her off the ventilator because she was breathing on her own.
Towards the end of your care at Lurie Children's, your care team will discuss your child's progress with you and let you know if they would benefit from and qualify for the transitional care program. This would provide a step between the hospital and home care and give you the chance to complete important training related to your child's care. This will also give you the opportunity to learn the day-to-day skills that will be required to care for your child safely at home. The decision to move to transitional care will be made only if your child is medically stable and the team believes that your child is ready to be moved from the hospital to a more home-like setting to continue their care.
They kept preparing me when she was finna leave because she was doing so well. Her weight was stable, her breathing was stable, she wasn't having no DSATs or anything like that.
Before you leave Lurie Children's, you will have a chance to meet the staff at Almost Home Kids and tour the facility. This will be a good opportunity for you to ask the staff about any concerns that you may have about their transitional care program. This will also allow you to review the pre-admission packet and your child's chart with the new care team and finalize all necessary arrangements. Once you are ready to be discharged from Lurie Children's, your child may be transported directly to Almost Home Kids by ambulance or by medical transport. Parents or caregivers will have to complete a training and visitation contract to transition their child's care to Almost Home Kids. In addition, a medical plan of treatment will have to be completed and signed by your child's physician before admission to Almost Home Kids. If you have any questions or concerns about the next phase of your child's care, be sure to talk with your nurse, your case manager, and other members of your care team. If you are wondering about what you should pack for your child's stay at Almost Home Kids, we suggest you take regular clothes that allow for daily activities. Laundry is done on site, so be sure to label all your child's clothes with their name. You will also want to take any products that your child normally uses, like toothpaste or toothbrush, shampoo, soap, lotion, hairbrush, and so on. You may also bring personal items for your child, like a toy or a stuffed animal, that would help comfort them during their stay at Almost Home Kids. Once you arrive at Almost Home Kids, the admissions process will take about 60 to 90 minutes. It could take longer if changes need to be made to the care plan. At the time of admission, the nurse will do a physical exam of your child and review all the medications and treatments to make sure that the list is up to date. To protect your child's privacy and safety, we will ask that you provide an approved visitor list and a list of emergency contacts. Visiting hours are from 10 a.m. to 9 p.m., and siblings are encouraged to visit in the common areas. You will also be asked to sign a confidentiality agreement and consent forms for your child's care and treatment. While your child stays at Almost Home Kids, they will receive nursing care around the clock, and you will need to complete various stages of training. Before you arrive at Almost Home Kids, all the necessary medical equipment has to be delivered by the supplier so that everything is ready to go when you arrive. Usually a 1 month's supply of everything that you will need will be delivered and inventoried by the staff. You will be taught how to keep track of your child's supplies, when to reorder, and how to use everything that you will need. Feedings for your child will be prepared and provided according to your request and according to the physician's orders. You will need to keep any necessary supplies like G-tubes, feeding bags, feeding pumps, bottles, or cups at Almost Home Kids. If you want your child to be given any other prepared food or snacks that are approved, please remember to provide those to the care team. In addition to the constant nursing care, the medical director and advanced practice nurse are on call and will round twice a week. Your child will continue to receive physical therapy, occupational therapy, and speech therapy as part of their transitional care. A child life specialist will also be a regular part of your child's care team to provide support, encouragement, and age-appropriate play. And all families will receive social work and counseling services as needed. One of the most helpful parts of your child's stay at Almost Home Kids is that you will have a chance to learn how to safely use your child's very own home equipment. This will be extremely useful in becoming confident and knowing how best to care for your child in a home-like setting before you actually have to take them home. Your nurse and case manager will work with you to lay out a training plan specific to your child so that you and any other family members have enough time to learn and practice all the necessary caregiving skills. As part of your training, you will be asked to call every day if you cannot visit at least 2 times a week, and provide independent care for your child for 2 24-hour periods. This will help prepare you to safely care for your child at home.
I already had some training at Lurie's hospital. So basically when I went to Almost Home Kids, I just had to learn her machines and how to use them and how to take care of her and look for signs of emergency and when to call a doctor. It's another person that has to be trained. It's my mom. So she started her 48 hours tomorrow. They teach you how to be confident, to put your fear aside, like you have to do this.
Before you leave Almost Home Kids, your social worker will connect you with the necessary resources to have your home ready for your child's arrival and to continue their follow-up care. We encourage you to visit Almost Home Kids before your child is moved so that you can see the home-like setting and ask the care team any questions that you have about the care your child will be receiving.
If you have a sick child, it's never easy because you actually a mom and a nurse at the same time. And especially not easy if you have other children. I'm very prepared. I'm ready to bring my baby home because she hasn't been home since she's been born.
The goal of moving your child to transitional care is to give you and your child the extra support needed before going home. Keep in mind that even after your child goes home, Almost Home Kids will continue to be a resource for you, with locations in Chicago and Naperville. We wish you the very best as you prepare to transition your child's care from Lurie Children's to Almost Home Kids.